I will start with our presentation on modeling motivation and lifestyle change in patients with type 2 diabetes. We will focus on the Dutch situation here. And next slide, please, Simon. And we will focus on exercise. Well, diabetes, as you probably know, is a chronic lifestyle-related disease, which is prevalent, unfortunately. In the Netherlands, we have about 1 million patients suffering from type 2 diabetes on a total of 70 million people. And the disease is rather abstract, so people feel a bit tired, they might be thirsty, they're not very happy. And well, the doctor says that their blood glucose is not right and they get medication and well, then their life just continues like that, basically. That's the normal story. Well, they are prone to severe complications as their neural and vascular systems are affected by the disease, by these blood glucose levels. And eventually they might develop a cardiac disease or kidney disease or other severe problems due to vascular or neural problems. Lifestyle factors are important, diet and exercise, in developing disease, and they also give a chance to treat the disease. If patients start eating in a healthy manner and moderately and exercise on a regular basis, they really have a good chance to change their condition for the better, and a subgroup can even reverse the disease. In the best study so far, about 150 patients were treated with shakes and packages with food, and they lost about 15 kilo, and then they had 80% chance to change their disease, to not be a diabetic patient anymore. However, in practice, in real life, only a fraction of patients successfully change their lifestyle. And by far the most stick to their old habits and take medication and, well, slowly decline. So here we see a picture of an exception. About 5,000 patients in the Netherlands joined this walking program. It's about they walk for 1 hour in groups every week. And already then you see a positive results on their mental state. Next slide. And I myself, I've been working on this for a couple of time, for a while, and this is an article, a lobby article in a national newspaper in the NRC for Dutch among us, to ask for more attention for lifestyle and in diabetes care. And well, we try to work on that. Next slide. And for me, it was very interesting to do this project together with Simon and Sietse. We compared blended care. That's where you see the purple image. It's a care program that I'm trying to get a pilot financed through my work as a healthcare insurance. Lifestyle coaching through your smartphone, set up as a 20 weeks program and carried out in cooperation with the general practitioner. And we compare that with standard care, a checkup by the assistant of the general practitioner once every 3 months. And lifestyle advice is standard part of the consultation. So basically, someone tells you every 3 months, you should exercise more and you should lose weight. So now I give the floor to Sietse.
Next slide, please. So we created the model, and one thing that is very central to the model is the types of motivation. So we make a distinction between 3 types of motivations. You see a couple of more here, but the most important are extrinsic, which is of course the physician telling you to exercise. And that can actually have a negative effect on your emotions because you might feel pressured into doing it. You might think, well, now I'm losing my comfortable life that I had. I can't eat all the fried goods I used to eat. I really need to change. And that might have a negative effect on how I feel about myself or how I look at myself. Whereas introjected motivation or autonomous motivation is still extrinsic. It's still the physician saying, well, you should exercise, but now I understand at least that it's in line with my my kind of goals that I have in mind. It's just that I find it very difficult to adapt, basically. And lastly, we make the connection to intrinsic motivation, of course, which is I want to do this, I feel like I can do this, the enjoyment of actually exercising. Next slide, please. So for type 2 diabetes patients, we have a variety of barriers that may come along when we're talking about changing their lifestyle. So getting them to exercise more. And there are some mentioned here, like negative emotions, like negative physical states. A lot of patients with type 2 diabetes have joint pain, are tired. So it's difficult to exercise. Often they are depressed as well. And as I said, extrinsic motivation may actually attribute to this kind of barrier to change. You can move on to the next one. So there are, of course, promoting factors, because if I do exercise, I might at some point see a change in my body. I might feel better at some point. I might start to enjoy it. But also I might, if I'm confronted with it, I might start the disease, I might take the disease more seriously. And at that point, I might also feel more motivated, in a sense, to actually change my lifestyle. So there's also a component of knowledge here. If I understand that this is something serious, I might do better at adapting my lifestyle. So now we are going over to the model. And this is the base level without the top layer. So there are a lot of arrows here, and most important is the preparation step, which leads to action, which leads to the kind of habit formation. We are in the end after a kind of lifestyle adaptation, which means that we need to form a new habit. But there's a lot of things that interact with the habit formation, and of course it takes a long time. I mean, the literature says that it doesn't happen overnight, of course, and if you think about it, it often takes time to get used to some kind of new normal. So there are some adaptive relations here as well, and if you can go to the next slide. There's one T state which is important, because action might influence our threshold for negative emotions. If I get into action, I might at some point become more resistant to the kind of negative feelings that I feel. Whereas in first glance, I might feel really negative about the fact that I can't do this, or the fact that it pains me. I might feel all these things, but over time, given enough exercise, given enough repetition, I might get a certain threshold for this. So we used Hebbian learning with an adaptive speed as well to make sure that the model has a certain variety of ways of interaction. And the results are actually rather interesting, but I'm going to give that to Simon.
Okay, thank you. Again, it's a very complex model, and I will just go through some main results from looking at this temporal causal network model. And first, here is the standard case, where nowadays, many places, you only get an advice every 90 days. And you can see the spikes coming every 90 days. So that's where you get an advice, go out and exercise more. But what we don't see here is, according to our model, and which is consistent with what happens in real life, is that you don't pick up a habit on such infrequent advice given. So you can see here that there is always resistance coming from bodily pain, your negative emotions, and your motivational drives that make sure that you don't pick up this habit with such infrequent suggestions to go out and exercise. So with more frequent advice, and that's what you can see here on the left, you can see at the first 100 days, you get here in our model, we use a step model to say that you get very frequent advice. And then what happens here in the first slide, what you see is now the dotted line is suggesting that now you're actually out there doing the action. You're exercising, but what we want to see is that you also pick up the habit to exercise. And in order to go for that, we have to dive in a little bit more into the model. So this one here is the first slide, where you see due to this very frequent suggestion to go out and exercise, then the patient is strongly inclined to actually do the action, And then in order to understand how the habit picks up, then we dive into the model. So first we see, and that's the negative thing here, is that when you begin to exercise, then your negative physically body state begins from a high level. So you first feel a lot of pain going out to exercise. Here it's model where you see the graph, it picks up at 0.8. So that means that you experience a lot of negative physical body states, but then it begins to drop off as the exercise continue. And then your physical body state, the representation that you have a sense of well-being, it begins to rise, which you see here in this parameter. We have a node model for this in the diagram. And we also have models, as Sitze explains, some thresholds for your negative emotions. So we modeled that as you become more and more exposed to the suggestion go out and exercise, we have modeled that a threshold for experiencing these negative emotions goes up, so it becomes more of a stable and it just doesn't spin out of control. So we model that, and you can see it rise here. And then moving on to, if you look at the right, you can see the node X2 is the habit, and it's very complexly mingled with all of the other states. But if you look closely, that you can see that it gets some input from intrinsic motivation and action itself. So if we look at those two values, when they begin to pick up your intrinsic motivation and you do a lot of action, then you are on a good path to actually pick up the habit. And then again, a deep dive into the model, you can see that we have modeled a weight which connects from these, I believe it was the intrinsic motivation down to the actual habit forming. So first we see that weight becomes bigger. So you can see it rises here with the curve with the dots on it. So that rises. And then eventually you can see that your formation of your habit comes up. And that's the graph that you're looking at here. So then for the discussion part, we kind of wondered, of course, whether this was also, all of this was in accordance with both theory and what you could experience in real life. And we did a few experiments tweaking with how much advice you could give in order to pick up the habit. And you can see one of these advice, which might not be totally connected to reality, but in our model, you could give way little less advice and still pick up the habit, which this will show. Whether this is consistent with reality, I don't know. I could comment on this and, for further discussion. But this was our results. So that was basically it.